In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
Let's talk about medical hypnosis and what it can do for your health. My guest in the studio today is Harald Krutiak, a hypnotherapist from Berlin. Hello and welcome to In Good Shape.
Hello.
What can hypnosis do and where are the limitations?
Hypnosis as an expression describes two phenomena. One is the procedure of getting into trance. The other thing is the state of trance. It's actually a state we experience all by ourselves several times a day. Hypnosis allows us to get imaginations in our brain which are normally censored by our consciousness. For example, a depressive patient imagining himself being self-confident, reacting appropriately in social situations. And you can also use it because this border between mind and body becomes more fluid, so you can influence physiological processes much easier in the state of trance. And
what's actually happening in the brain?
We can describe two major phenomena. One is that the electric activity is shifting from, we are now in beta condition, to alpha waves. Alpha is
brain waves.
Exactly, yeah. It's the electric activity you can measure with electroencephalograph. And so this is connected to states of relaxation. Yeah, meditation, it's the same. And we also find that some areas of the brain, namely frontal parts, get lower in their activity. So we also call it the state of hypofrontalism, which means that our critical thinking gets down, and we can imagine things. Normally we would say, but this is not me, or I can't do it, I cannot lose 50 kilograms, whatever.
And how's the hypnotist actually achieving this? What's he doing with the patient?
Yeah, the main thing is we focus people's attention. So, for example, we sit now, we talk to each other. Perhaps you forgot about the cameras surrounding us or the people surrounding us. This is actually some kind of deep trance phenomenon, because they are there, but you did not perceive them in a conscious way.
So it's a kind of hypnosis, what we're doing right now?
Exactly. In some ways, we could say in a modern way, this is a kind of trance. Yeah.
Okay. And what kind of health problems can you affect with hypnosing?
It can be used in two ways. One is that somatic illnesses like high blood pressure, asthma, immunological disorders, multiple sclerosis, cancer, I work a lot with cancer patients also, can be influenced positively. And you can also use it for some invasive interventions like gastroscopia, or with dentists it's very common in use to reduce pain, lower anxiety, and that much.
In other cases you should not perform hypnosis?
Well, with psychotic disorders, it's a bit critical. It should only be used by very experienced hypnotists.
Quit smoking with the help of hypnosis. How does this work?
Well, hypnosis is solution and resource orientated. So we don't say smoking tastes ugly or things like that, but we create or we support the patient to create an image of himself in a future where he quitted it already. And what he's gaining then, what is the benefit of having better condition, being able to get the stairs again at home without a lack of breath, and to make this goal very attractive so it becomes more or less self-evident to go there.
We got a lot of viewer questions about hypnosis. It's a very interesting topic. Laura Lee from Canada asked on Facebook if hypnosis can be dangerous, for instance, if you don't wake up after hypnosis.
Well, as every powerful intervention, hypnosis can be, in the wrong hands, be dangerous. So therefore it's important that you have qualified persons using it. This myth of not waking up, never experienced to me in my everyday's practice, or you find it in literature. Finally, when people have to go to the toilet, they wake up.
Yes. Dani Kranendonk from South Africa asked about self-hypnosis. So don't you even need a therapist to go into hypnosis?
I use in my work self-hypnosis a lot by teaching it to patients. Once it's trained by a professional, it's a very elegant and easy way of getting yourself into a state and having like a meditation, a different approach to problems or questions of everyday life.
And in what cases could you use it just for relaxation or even in therapeutic approaches?
As well as it can be used to lower tension, for example. It can be used to reduce anxiety. My people with flight anxiety, for example, use it before they go onto the plane, before the boarding starts. And it can just be a means of well-being. It's a lot of different possibilities.
And how do you learn it, self-hypnosis? Just read a book?
You can learn it through books, you can learn it through CDs, DVDs, but I think the best and most elegant way is like to see a hypnotherapist that teaches you.
So book a session and then just learn it and do it yourself. Marigold Tonelli from Slovenia asked the question if hypnosis can help with neurotic jealousy.
Well, this is a very general question. I would check what's behind this jealousy. Perhaps it's for good reason that this lady is jealous because her partner is very flirting around, so it might be reasonable. The other thing is it based on low self-esteem, for example, and we would improve the self-esteem. So one would have to check what's behind it. The jealousy is just like a symptom.
I mean, you are a psychotherapist, so you put hypnosis into a whole big context and do more than just hypnosis. If I'm a patient and I'm looking for hypnosis, what should I look for in a hypnotherapist?
Well, it's important that this therapist has a profound training in the back, like being a medical doctor or a psychologist. And he should be trained by a certified institute, and most important is the personal connection you percept to the person, because trust, I think, is the most important indicator for therapy success.
Thank you so much.
It was a pleasure.
It was a pleasure for me too. Thanks so much.